Hi, good afternoon, everybody. I'm Jody Hanson. I'm Director of Public Affairs and Communication for Johnson County Government. Thanks for joining us today. With us is Dr. Sami Ariola, who is the Director of Johnson County Department of Health and Environment. We also have Elizabeth Holshoe, who is the Director of Epidemiology, and Nicole, thank you for being here as our ASL interpreter. Dr. Ariola, we had a clinic today, I know. Please let us know how it went today.
Thank you, Jody. Good afternoon, everyone. We actually had two clinics today. We had clinic at Okun where we were vaccinating people, largely second doses for Moderna and for Pfizer. And all of the clinics ran very well. We also had a clinic at Sunset Office building here, which was targeted for second doses for our law enforcement group this morning. Went pretty well. All said and done this week, all of our clinics, which turned out to be 6 clinics, 4 at Oakland, 2 us at Sunset Office Building. Worked pretty well with thousands of people receiving either their first doses or their second doses. And also this week, which has been pretty significant, is the approval of the new facility by our Board of County Commissioners, which we are very excited about. That gives us a fixed location, helps us out logistically. Right now, because we have had to go to multiple locations, we've vaccinated here at our health services building. We have vaccinated at the Sunset Office building. We've used Arts and Heritage, and we've used Okun. And so every morning we have to assemble, and every afternoon we have to disassemble. All of those are lots of efforts that this should take care of with a fixed location. Also, it's kind of a central location that's helpful to our residents to know. This is going to be at the 15500 West 1/8 Street in Lenexa. And I believe it's at the corner of West 108 and Lackman, and the building is there. There will be wayfinders there helping people get to know where that place is. And we hope that just that one location will make it not just easier for our residents to come to, both for their first and second doses, but a lot easier in terms of logistics. So we are very appreciative of our Board of County Commissioners for that step, and absolutely appreciative of the efforts of our facilities, county manager, and other Johnson County departments that are assisting in this effort. And of course, our good friend who sees our Facebook Live going all the time, our DTI group, Bill Nixon and his team. Thank you very much. We appreciate that. But in terms of vaccination, we have beginning this week and next week really largely open up clinics to our residents that are 65 plus, those that are 65 or older. And we open up thousands of appointments for next week. And the last time I checked, there's still a few opportunities for you to book an appointment. Obviously, we're still also allowing those that are healthcare workers to book appointments. And so, but there's never been a better time for you if you're 65 plus to book an appointment. I will say that we went through our list and sent the opportunity to over 20,000 persons there for those appointments. I know several of you have been vaccinated. That's great. That's what we want to see. If you've been vaccinated, that's all good. If you have not, make sure you book one of those appointments. There are also several agencies that are calling to assist. We have several people that are at our call centers that are assisting people to book appointments. Still, our health systems are also still taking appointments, and will continue to do that next week and beyond for those that are 65 plus. So so that's a good thing. The other things that's occurring simultaneously that Elizabeth will talk about very soon is our continuing efforts in our K through 12 educators as well as childcare. There's some good news in that category also that she will talk about. But I also want to mention that we are working to vaccinate in the rest of our phase 2. We are working with several community partners, UCS, Health Partnership Clinic, and others to ensure that we're doing that. I know, for example, that vaccination at Safe Home is expected to begin on Monday. Vaccination at Project 1020, actually, I believe, is starts this evening, and there are conversations to begin vaccination next week at Salvation Army. That's going to be handled by Olathe Health. I believe those are set for March 11th and March 13th. So there's a lot of vaccinations that are ongoing. Of course, our largest two groups are still our 65 plus, as well as our childcare facilities. I just had a conversation with our corrections facility, which is another group in phase 2, and trying to work out the logistics of vaccination there. This week, we provided vaccines to vaccinate at JCDS and other IDD facilities in the county. And I'm saying that just to tell you that work's ongoing. We're very happy to be vaccinating broadly in these categories. We're very happy to be getting vaccines into the arms of more of our residents, and that continues to be our goal. And Elizabeth, would you just talk about what's going to happen in the next couple of weeks with K through 12 and childcare, but also now venture into what to expect in terms of our residents being able to prepare for phase 3, phase 4, phase 5 in terms of signifying their interest moving forward.
Absolutely. Thank you, Dr. Ariola. I'd also just like to point out that really these other groups, some of these hard to reach populations, our homeless population, individuals with intellectual or developmental disabilities, these individuals are very hard to reach and difficult to vaccinate for a variety of reasons. And so the fact that we've gotten Johnson & Johnson vaccine in, which is a single dose vaccine, has really allowed for us to maximize our ability to immunize these individuals with as minimal disruption. We are able to get one shot that's very effective into, for instance, people who are experiencing homelessness, who maybe wouldn't be able to get back for a second shot to really receive that full immunity, or individuals with an intellectual or developmental disability who may be a little harder to vaccinate just in general because of their disabilities. And so the fact that we can use Johnson & Johnson is a huge win, I think, and enables us to get through those groups. As for our K through 12 and our childcare, we have been continuing to move through that really in very close partnership with Children's Mercy Hospital, Kansas. And this week we did a little over, or right around 1,150 doses in our childcare providers on Tuesday. And then we've done about 2,300 doses, or will by today's Friday. So we did 2,300 doses Wednesday and Thursday for the K through 12 educators. This week we've also started doing second dose clinics. So we had a second dose clinic for our School of the Deaf staff, as well as childcare providers and private parochial schools and K through 12. And we'll also do another first dose clinic for our K through 12 this week on Saturday. And then we hope to have just a few more clinics next week to really wrap up our childcare, our school age programs, homes, centers, K through 12, public and private parochial. So really at the end of next week, we should be finished with our first dose clinics for all of those staff who have expressed interest in receiving it. And we'll be able to complete their second dose shots by the end of March, really. So we are all very excited to be moving through this. We've got, all of our schools are bringing students back full in person, and really having teachers immunized means that the schools won't really be struggling with staff being out on quarantines. So right now, before we had vaccinations, if a staff member was exposed to COVID-19 in the community or in school, they'd have to go home for several days to make sure they didn't get sick. But now, once they are fully immunized, about 2 weeks after that second dose, if they get exposed, as long as they don't have symptoms, they can stay in school and teach. And that's a huge piece when we think about continuity of learning for for students. And so we're very excited. And I think this will really aid our schools in at least removing one barrier to having kids full in person.
And I know that's also really important for parents who perhaps work during the day. Obviously the continuation of learning is key and a priority, but also for parents to be able to work and keep their jobs. I mean, having your kids in school or in childcare, if that's what you need in order to work, is really important for families and for the economy. So I think that's one of the reasons you had prioritized those groups. I don't
Absolutely. Schools and childcare centers don't just impact the students or the children who are in them. They impact the families, and that in turn impacts employers in our economy. So, we think about healthcare workers who are really reliant on childcare in particular, so that they can be in the hospital working. And in particular, in the COVID pandemic, that's been a huge thing. We've had a huge shortage in nurses and physicians and staffing in our hospital. So being able to keep childcare centers and homes open means that parents can work. They don't have to worry about their income or, getting food on the table. We know that this pandemic has increased food insecurity throughout the country. And so, the ability for individuals who do have a job to be able to continue to work that means they don't have to be concerned about where their next meal is coming from or how to pay the rent. So really our childcare centers and our schools being open doesn't impact just those families that are directly involved with them, but really the economy and our community as a whole. So on a number of fronts, I think this is excellent news as we continue to move forward and try and attempt to have some level of normalcy as we sort of are struggling through hopefully what is coming down on the far side of this pandemic.
And Jody, and I think that's one advantage to having a fixed location that I did not mention is right now for you to be able to come to our clinics. Ours, the one that we're doing through K through 12 as well as child care with the Children Mercy, they actually are able to have clinics at different hours, including weekends. Right now for us, because of the limitations in location, hours are in the morning. So if you are working in the morning, you are at a disadvantage. So one advantage of the fixed location is then that we can have clinics on the weekend and have clinics after hours to ensure that equity is part of what we do. So that's an advantage. So just because you're working 8 to 5 shouldn't be an obstacle for you from getting the vaccine, and we'll be able to do that. Now, a lot of the questions that we have been getting has been, how do I register for phases 3, 4, and 5? What are the next steps? How do I know where I stand? And so I want Elizabeth to talk about what to expect for our residents next week.
Absolutely. Thank you. As you all know, we are in phase 2 at this point. We have a phase 1 survey out. So if you're a healthcare worker who was perhaps missed in phase 1, if you go to jocogov.org/healthcare survey, one word, you can go ahead and fill that out and we'll be able to work you into our vaccine clinics as we start moving on. But obviously, as Dr. Ariola talked about, we have made incredible strides in hitting some of these populations, our congregate settings, our IDD populations, our homeless populations. And so as we move through these really big groups in phase 2, tier 1, the 65 and up and our K-12 through 12 educators and childcare providers, we're really hopeful that we will be able to move through the subsequent parts of phase 2 pretty quickly and start moving into phase 3, particularly if our vaccine allocations increase. And so my team has been working on developing yet another survey for our residents to fill out. And this one will be for everybody in our community who is interested in the survey, whether you fall in phase 3, 4, or 5, to go ahead and express your interest in receiving the vaccine. And so we are hoping to get that out early next week. So in one of the Facebook Lives, we'll be talking about it. So stay tuned. But really, we are looking forward. We're looking forward to how to really implement these next phases. They're very different than implementing a 65 and up vaccination campaign. So it's just really exciting for us to see the progress that we've made, both Johnson County Department of Health and Environment, as well as our healthcare partners and other partners in the community in moving through these really vulnerable populations. So stay tuned, come back here next week and we'll have more information on how to express your interest if you're not in phase 2.
And I do want to emphasize, thank you, Elizabeth, emphasize to our residents that we will continue to walk in everyone that is 65 plus into our clinics, even beyond next week. Based on our numbers, we know there's still quite a few persons that needs to be vaccinated. Perhaps some have questions. We're very happy to answer your questions about the safety and efficacy of the virus. It's now been taken across the country by over 80 million people across the world by a lot more. These are highly efficient and very safe vaccine. And the more of us that takes the vaccine, the better for us in being able to suppress the virus. So we are still reaching out to our residents that are 65 plus who have not booked an appointment to do so. Our call center are there to assist you. We have different organizations that are reaching out to people in that category. We'll continue to do that. But you will also note that we are preparing and venturing into other categories in phase 2, including tier 1, tier 2, and tier 3. We are working with them. We're looking at how many persons are in that group. We're working out logistics of how to do that. We're working with our partners and stakeholders to be able to vaccinate in those groups. We're working with pharmacy groups. We're working with our FQHC Health Partnership. We're working with other health systems to prepare for that. And again, like Elizabeth said, those are not very large groups. Our largest group are still at 65 plus, which is still our priority. Still, age is one of the critical predisposition factors here. So take the vaccine. We continue to work on that group and ensure that that remains our primary focus in the vaccination. But we're also prepping, as she said, to have an idea of who and how many people we are going to be dealing with in phase 3, phase 4, and phase 5. And also by completing those surveys, you will have your information. So as vaccines become available, we'll be able to push information out to you.
And a couple questions about phase 3, 4, and 5. Will people in those phases be able to get vaccinated at the healthcare systems, just like phase 2 is? Will that be an option? As well as the pharmacies?
Yes, that would be an option, at least for the health systems where we all receive from the same pool of vaccine. We are in this together, and they're ready. They're ready to continue to vaccinate. Of course, moving to phase 3 is when to move to phase 3 is an announcement that the governor and the state will make. All we are really doing is prepping for that. We still have a lot of work to do in phase 2, and we want to make that clear. We're in phase 2. All we are doing is collecting information that will allow us to plan better for phase 3. But yes, we are in this with our partners together. We talk to them on a regular basis. And when we all feel confident that we are ready, or rather, we'll be ready to move on as when the governor makes the announcement. We still have a lot of work to do in phase 2.
And if I can just follow up on a couple of comments Dr. Ariola made, both about the efficacy as well as the safety of COVID-19 vaccine. You know, he said 80 million individuals in the US have received the vaccine. The number of allergic reactions or severe reactions are very, very small. These vaccines are incredibly safe. But also we can just look to our long-term care facilities to see how effective they are at preventing COVID-19. You know, we started vaccinating, and by we, I mean our pharmacy partners started vaccinating in these long-term care facilities in December. And right around that time, we had 49 outbreaks in our long-term care facilities. This week, we are down to 1 outbreak in a long-term care facility. And that is really just a huge part of that is because of the vaccination campaign of both staff and residents in these facilities. And while we will continue to work with our healthcare partners, I do just want to offer a word of caution. I think some individuals are hoping that they'll be able to receive their vaccine in their healthcare provider's office through a normal appointment, the same way you maybe would during for flu vaccine. I think that we're probably a little ways out from when, you know, your primary care provider will have this in their office to be able to provide that vaccine. So if you're interested and you have that opportunity through through the hospital system that your primary care provider is affiliated with, go get it if you're interested, because it may be a while before you're able to, you know, just go for that regular appointment and get it then. So take it when you can get it. I know that these big vaccine clinics are not optimal. They seem a little overwhelming, but I'll tell you what, both Johnson County Department of Health and Environment, Children's Mercy, and our healthcare systems have done a tremendous job of being able to push people through these vaccine clinics in a very short period of time. I think, from at least Children's Mercy was saying they were there for 20 or 25 minutes, but 15 minutes of that was them being observed to make sure they didn't have any reactions. So really, these appointments are going very quickly. You're not standing in line for hours and hours and hours. So if you have that opportunity, if you're provided that opportunity and are interested, please go ahead and get it.
Great. Thank you, both of you, for sharing some really good information today and some great progress. I'll go ahead and take a few questions from Facebook. Somebody wanted to know if we've completed your interest survey and have gotten vaccinated elsewhere, do they need to let us know?
No, if you've gotten your vaccination, our goal is to get you vaccinated, and you have received your vaccination. That's all you need to do. We have a way of moving through our list and doing the best that we can to estimate where we are. And so, no, the only thing you need to do is get vaccinated. You've done that. You're happy, we're happy.
Okay. And you might have addressed this. Can you touch on when you anticipate moving on to tier 2 and 3 of the phase 2 group, essential workers that are not healthcare or public safety? So again, is that dependent on the doses, or what is our answer to that question?
It all depends on doses. It depends on how many 65 plus we continue to get, but we already venturing into that. We are vaccination in our homeless population. Again, for those efforts that require a little allotment here and there, for those efforts that we feel it's more feasible with the single shot J&J for logistical reasons. We are doing targeted venturing into tier 2. But we also know that we have also in tier 1, we still have grocery store workers as well as others there. And we're working on that. I think by middle of next week, you are going to be hearing a lot more. But yes, we are looking at different groups in tier 2. I would be doing tier 1 and tier 2 simultaneously very soon. As I think by next week, there will be some vaccination occurring in tier 2 also. So yes, but again, still understand that I'm looking at the numbers that Elizabeth sent to me earlier today, while understanding that we still have a couple of large health systems that are still not reporting. Thus far, about 90,000 shots have been given in the county. I believe the data would maybe, as of yesterday, I'm not sure it includes our data from yesterday, definitely not our data from today. And so those numbers, if you were to ask me, based on what we know about some of those health systems, I think that number easily is over 100,000 at the end of today, easily. And so even though it appears slow, it's ongoing. But looking at the number of vaccinations in 65 plus, compared to what we know about our demographics, there's still a significant portion of our population that needs to be vaccinated in that group. So it might require us to do some outreach. It might require us to engage even more of our resources in the county with people that have relationships with the community. It might require us to do some work letting people understand the safety and the efficacy of the vaccine. But we want to make it clear that continues to be a priority, because we know our older population are more susceptible to this. But we will continue to, a lot of the groups that we have in tier 2 and tier 3 are really not, they don't require several thousand doses. There are quite a lot of them just require a smaller amount of vaccine. And so we're going to be doing that while maintaining our focus on the 65 plus population.
Dr. Ariola, while you were answering that, you were talking about the numbers of doses. So I shared my screen to show the page on our website where we're tracking first doses, second doses from the county and from DHE. And we did have a question about that. Someone was just asking for some clarification. So I might put that up on the screen again when you answer, but they want to know, what are the total first doses given in Johnson County? Is it the 57,356, or is it that number plus the 23,856? So again, I'll just go ahead and share that screen, and this is available at jocogov.org/COVID-19, or I'm sorry, coronavirus. If you get into the vaccination section, you can go to the vaccine distribution data, and we list that there every day.
All yours, Elizabeth.
So the Johnson County numbers on top are overall, so that actually includes what the Department of Health and Environment has administered. So we have administered 57,000 first doses, but again, we know that one of our two hospital systems are having issues uploading to KDHE. They're working very closely to remedy that. And I will say that we got those numbers from one of them, and it's an extra 10,000 doses in that 65 and up population. So this is an underestimation. I agree with Dr. Ariola that we have probably administered over 100,000 doses, both between DHE and our partners in the community, to Johnson County residents.
Great. Thank you for that clarification. We had a question about Moderna. People are wondering, are we getting any Moderna, and what about second doses of Moderna moving forward?
We opened up appointments for all the remaining Moderna vaccine eligible, second dose eligible residents that we have today. Now, if you could not make it for whatever reason, just reach out to us. The simple answer to that is yes, we have your second dose with us, and we'll make arrangements to give that to you. I do want to be very clear. There are several things that we are seeing that we need to make clear. Your first option, or your option for where to get your second dose, is where you get your first dose from. So if we start to, so what we receive as second dose is based on what we are giving as first doses. So we can't really afford to give second dose to people that did not receive first dose from us. And so when we do too many of that, it's very disruptive to our process and to our tracking. That's the first thing. Second thing is, today alone, close to 10 emails have been forwarded to me in some form or another, people saying, where I got my first dose is saying that it's not available anymore. And so, so we're asking questions now that tell us where you receive your first dose, because where you receive your first dose, they automatically receive the second dose from. So it's very important that if you're asking, if you did not receive the first dose from us and you're asking us for the second dose, that you be very clear that as to where you receive your first dose is not giving it to you, because it doesn't add up in some way unless something has happened. If they're saying they don't have it, you should challenge them because they were sent the second dose. Now, so we are going to be asking questions and trying to verify why they can't give it to you before we look into what we can do about it. But if you are eligible for your Moderna second dose with us and you couldn't make it to our clinic today, we do have your dose. Reach out to us, jcdhe@jocogov.org, or call us 913-715-2819.
I'm going to share that. I wasn't quick enough to get it up while you were talking about it, but there it is. There's our phone number and our email address. Yeah. Probably time to wrap up for today. So I'll just ask either one of you if you have any closing remarks to make.
Has been a very busy but productive week. Our goals remain the same, to vaccinate as many people as we can. Lots of logistical things to work on, but they're working out very well. Our partners are rising up to the challenge. We're very happy that we are starting to vaccinate in our homeless population. From what I heard about the shelters, which is typical, once the weather becomes good, a lot of them are going to wind down in the next few weeks. So being able to get the vaccine into the arms of our residents in that category is very helpful. Had a good conversation with our corrections facilities today, and those plans are in the works. We're very happy that we're able to finalize plans to vaccinate in our intellectual and developmental disability group. And all those are really good. Continuing to be very happy about the thousands of doses that were given out to our 65 plus category. We're obviously very happy at the trajectory of our numbers. Hospitalizations are down, deaths are down, cases are down. And like Elizabeth said, with our 3 vaccines, just being able to have 3 vaccines that are able to 100% prevent death and hospitalization and severe illnesses, that's a big deal. And so our goal then is to continue to create conditions where we can vaccinate as many people as we can, as quickly as we can. So again, continue to appreciate and your understanding and patience. We are also looking forward to a time when we get to a point where we have enough vaccines where if you want it, you can get it, and prioritization become less important. That's our hope. If you want it, we want you to get it. And so again, we appreciate the opportunity to just keeping you up to date, and there will be a lot of things happening again next week, and we'll do our best to keep you informed. Thank you.
Thank you. Elizabeth, anything else to add?
I think I'll just give the good old public health recommendations around COVID-19. Even though we have seen a decline in our cases and our hospitalizations and deaths, we do still have it out there. It's still considered substantial transmission by CDC's definition, but we have the nice weather coming. So if you are going to gather with friends or people outside your household, it's better to do it outside. Continue to wear your mask, continue to keep your distance. If you are meeting inside, keep those windows open. The ventilation and fresh air will help decrease the likelihood of transmission. So, as vaccines are rolling out, we're getting closer to normalcy. And so if we can just keep doing the things we know can prevent transmission for a little while longer, I think we'll be in a great spot. So keep it up. I know we're all tired, but with vaccines rolling out and the hope that we can move into additional phases soon, I think we're getting there. So stay strong, and there is a light at the end of the tunnel. So, and enjoy your weekend.
Yeah, great words to end on. Dr. Ariola, Elizabeth, Nicole, thank you so much for your information today. And thanks to those who are watching and asking questions. And I hope everybody has a great weekend. Thanks so much.